the last 10 years, and we still keep saying it. And I think that is a statement in itself of the emergency that we have to face. Over 500,000 people, 1.5 million Americans have died of AIDS since the beginning of the AIDS epidemic. AIDS has been diagnosed for more than 1.5 million men who have sex with men, gay men. Over 300,000 gay men or men who have sex with men have died since the beginning of the epidemic. And in large cities, 46% of African American gay men and men who have sex with men are HIV positive. 46%, almost half. Two other brutal facts literally scream for a solution, and all of us, all we need is the political will to follow the enlightened leadership of President Obama, Congresswoman Barbara Lee, Congresswoman Eleanor Holmes Norton, and the Congressional Black Caucus. One in four African American women live in poverty and receive low-quality health care. They are at high risk for HIV/AIDS. Health care reform is a human right and will save their lives. So we should thank President Obama and the Congresswoman for making this really, really happen. Number two is a little bit more complex. Gay men and men who have sex with men make up 68% of all men living with HIV, but only 5 to 7% of men in the United States who report having sex with men are, in my terms, have the pride and courage to be openly gay. The point here is that we still have to address racism, homophobia, homo-hatred, poverty, and the lack of quality health care. We must have some structural interventions. We must have social justice and what Ted Kennedy referred to as economic democracy. AIDS deaths are a result of oppression and denial of basic human rights, even in our great country, even in America. As a person living with HIV/AIDS for over 25 years, and as President and CEO of the National Association of People with AIDS, I'm so proud that NAPWA is the founder of National HIV Testing Day. NAPWA represents 1.2 Americans living with HIV/AIDS. We want all people in America to take the test and know their status. Take the test and take control. We have enormous opportunities before us today. Sunday, June 27th, is National HIV Testing Day. Thousands of people across the country will be tested, even while, as we pointed out, we have a waiting list for medications. We do have, for the first time, a presidential administration which understands the AIDS epidemic and cares about the lives of people living with HIV/AIDS. We will have a national AIDS strategy. We have a dedicated, genuine partner from the private sector, from Orshore Technologies. NAPWA's partner in the mayor's campaign to end it against AIDS. Mayors like Mayor Bloomberg of New York, Mayor Daley of Chicago, Mayor Fenty of Washington, D.C. signed up to lead HIV testing events in their cities. We have over 120 mayors this year. And I want to thank Tom Kajowski and the staff of the National Association of People with AIDS, Garvin and Peter, Steve, Luan, all of you for making this possible. We have an AIDS warrior leading CDC and our friend Dr. Tom Frieden, who courageously implemented syringe exchange programs as Commissioner of Health in New York City and saved lives. I want to personally acknowledge our partner Gilead Pharmaceuticals, which saved so many lives through the development of new HIV treatments and medications, as well as our partners at NASDAQ and the National Honorary AIDS Council. I want to acknowledge our board members, Dr. Phil Terry, Executive Director of Prevention Works, Dr. Golden Down, who couldn't be with us today and was supporting us through very rough times at NAPWA. Like all nonprofits, we're challenged these years, but we're the oldest PLWA and AIDS organization, and we intend to survive and improve lives and be stronger. So with that, I would like to introduce, I'm very proud to introduce Congresswoman Barbara Lee.
Thank you very much, Frankie. Let me thank all of you for being here today. I want to welcome Don Davis. Thank you so much. I want to thank Congresswoman Eleanor Holmes Norton for her leadership and for really speaking out early on and addressing the issues of HIV and AIDS here in the District of Columbia as well as nationally. Oftentimes, these issues get swept under the rug here in Congress, but because of Congresswoman Eleanor Holmes Norton, Congresswoman Waters, Congresswoman Christensen, we're able now to have a critical mass here on the Hill to really do what we know is the right thing to do. Frank, let me just thank you so much, and thank NAPWA and the staff for, under very difficult circumstances, continuing to do the work, continuing to be on the front lines, and for continuing to be the voice for all of those who are infected and affected, and who need to really understand that this is a global pandemic. It affects primarily African Americans disproportionately, both here in our own country, as well as in Africa and in the Caribbean. And so thank you so much for your leadership. Of course, the campaign for testing, which is run in conjunction with CDC. Once again, we're going to get tested. I myself, I know Congresswoman Warren, and she'll talk about that, has been tested. I think I've been tested probably 4 or 5 times publicly. It's very important that policymakers and members of Congress do this. Leadership, grassroots leadership, we have to make sure everyone understands that we know our status, that we get tested, and that this is an extremely important strategy to combat and stamp HIV and AIDS from the face of the earth. And so thank you for bringing forth the statistics. They're very glaring. Now, 21% or 1.1 million people do not even know, 21% of the 1.1 million, which is about 232,000 individuals, don't even know that they're infected. That is just simply tragic. So I'm going to introduce our resolution again with NAPWA and the goals of the National HIV Testing Day. Introducing resolutions, raise the awareness of what we're trying to do. We have a debate on the floor of Congress about this. Most of the time this is a bipartisan vote. And we want people to know that we must equip our young people especially with the tools to protect themselves from getting infected to begin with. And you all know about my bill, Responsible Education About Life, Be For Real, where we have to get rid of this abstinence-only policy. And that means teaching young people how to protect themselves. Yes, use condoms. Yes, abstinence. We have to have a comprehensive sex education initiative in our schools to help prevent the transmission of sexually transmitted infections and diseases, as well as HIV and AIDS. And I'm pleased that our president is living up to his commitment, following up in helping to develop a national AIDS strategy and plan. And I look forward to seeing that plan released, I believe, very soon. He made that commitment during the campaign, and he has lived up to that commitment, and we're moving forward so that we can have a clear federal strategy to support our grassroots efforts, which are working diligently with minimal resources to provide care, treatment, and of course, education and prevention. And we need more money from the Minority AIDS Initiative, which was initiated, I believe, in 1999 when Congresswoman Waters was chair of the Congressional Black Caucus. We still haven't gotten up to where we say a minimum of $610 million would just begin to make sense. I serve on the Labor, Health, and Human Services Subcommittee of the Appropriations Committee. And I tell you, it is a fight each and every year just to wrap up that funding. It started at $157 million and maybe close to $400 million, but we need to get it up to $610 million. So once again, we're reminded this Sunday that now's the time to take action, to raise awareness, and to educate people about how to protect themselves from this disease. I just applaud NAPWA and all of you for your support, your leadership, and for staying the course. Because trust me, up here on Capitol Hill, we wouldn't be moving forward on any front if it weren't for you and for your efforts at the grassroots level. So thank you again very much. I'll bring forward now my colleague whose district I reside in, who is my congresswoman, who is doing a phenomenal job, Congresswoman Honorary